Hi, I'm Barb. I am going to talk about a course I took with the MPTA about the hip assessment and kind of diagnosing the difference between a labral tear, a FAI injury, as well as muscle pain or athletica pubalgia or sports hernia. So I want to just give some basic information that we all might know and might not know, measuring just general hip angles or hip range of motion. IR and ER should be greater than 80 degrees, and then general strength testing. If it's less than 80 degrees, then there is some kind of, most likely some kind of hip pathology, as well as what's called a Copenhagen 5-second squeeze test, which I will demonstrate later, and then some different specific tests for each of those injuries that I will demonstrate. So first I'm going to go over the FADIR test, which is flexion, adduction, and internal rotation, which is indicative, along with other factors, of a FAI impingement or injury. So that is moving the hip that is suspected for injury into flexion, adduction, and internal rotation. Another factor is if the alpha angle, which is from ASIS to greater troch, measuring that, which is using the angle straight down to patella, back up, measuring that space right there. If that angle is greater than 70 degrees, especially greater than 78 degrees, is a severe morphology and just increases the odds that this could be the injury that we're dealing with. So another factor would be a FABERS exam or a FABERS test, which is flexion, abduction, and external rotation, but as well as bent knee fallout, which is measuring the difference between the right and the left legs. All right, so for FABERS, it is flexion, abduction, and external rotation, letting the leg fall down. And to measure the difference between this knee, the right knee and the left knee, you're going to measure from the outside of the femoral condyle down to the table, kind of let the patient relax, measure that distance, bring the opposite leg up, do the same thing. If there is a greater, do measure femoral condyle down to the table. If there's greater than 3.7 centimeters, it's indicative of a FAI injury. So the next topic I want to talk about is assessing for labral tears of the hip. So the first test I want to show you is the Fitzgerald test, which is going to test, I'm going to first show you two different tests. One, both assess for an anterior tear of the labrum in the hip. All right, so for the Fitzgerald's test, it's going to be two different. For the anterior labrum, it's going to be two separate tests. You're going to go into flexion, external rotation, and then abduction, straightening the leg out, like such. You're going to be listening for audible clicks and pain. That's indicative of an injury, of a labral tear, anterior labral tear. Then you're going to go from this position, you're going to, at the end, you're kind of putting them into internal rotation, adduction, and internal rotation, and that as well. So you're starting in flexion, going into external with a little bit of abduction, and then as we're straightening, pushing her back into internal adduction and extension. So this is the Copenhagen 5-second squeeze. You can also use it for strengthening, a strengthening exercise, if a patient is able to do so. And so now for a posterior labral tear, you're going to start with the hip in full flexion. You're going to go into internal rotation, adduction. So basically FADIR's moving into abduction, extension, and external rotation. So it's bending into flexion, adduction, internal rotation, extending into abduction, external rotation with some extension. Okay, And then one of the last tests I'm going to show you is the Thomas test. Most of us have learned this, but I'm just going to review it. So another piece of advice that the research is showing is making sure that when after we assess these patients, kind of find out the diagnosis, what is aggravating, we deload for exercises, and then work on that progressive loading, because it is important. And with these types of injuries, sometimes the rehab can be upwards of 6 months is what the research is showing. So don't be trying to cut patients out or send them to surgery too soon. So generally speaking, when we are talking with patients, we want to make sure that they're well educated if what we are doing exercise-wise is not working. And it does happen. So we want to make sure that we're educating them about their outcomes if they elect for surgery. And especially with labral tears, it is highly likely that they return to sport, but it might not be the same sport or at the same intensity. So that's dependent on what is important to that patient. If it's just return to sport, return to walking, return to squatting, but not at the same intensity, then that is something to consider with education.